Greetings and salutations. Thank you for lending an ear to The Voice of the Times for Wednesday, March 30, 2022. For today's editorial, Campaign versus TB, another victim of COVID-19 pandemic. Last Thursday, March 24, was World Tuberculosis Day, but the occasion passed with virtually no notice here in the Philippines or elsewhere, in other parts of the world where the COVID-19 pandemic is still a grave concern. Authorities and the public understandably remain focused on the more immediate public health crisis. We are faring much better in that respect in this country, but that may actually be part of the problem. The public is fatigued from having COVID-19 as a daily concern for 2 years. In addition, the impending election as well as other current events are powerful distractions, both for the public and the government agencies concerned. Disease does not respect society's priorities, however, and TB remains a serious problem, particularly here in the Philippines, which is unfortunately considered to be one of the world's hotspots for TB. According to data from the World Health Organization and the Department of Health, the Philippines ranks 4th in the world and 1st in Asia in terms of TB prevalence. An estimated 1 million Filipinos have active cases of TB at any given time, and about 70 people per day in the country die from the disease. TB is the second leading cause of death among communicable, maternal, neonatal, and nutritional diseases in the Philippines. The government has long recognized the seriousness of the TB epidemic in the Philippines, and the DOH has for years aggressively pursued a program to fight the disease, with some success. Even though the number of TB cases has steadily increased over the past several years, the number of TB cases successfully identified and treated have increased faster, leading to a gradual decrease in the disease's prevalence. Unfortunately, the COVID-19 pandemic was a significant setback to these efforts. Although figures for 2021 have not been made available yet, in 2020, the number of TB cases increased for the first time since 2005, both globally and here in the Philippines. It is believed that the number is even bigger than what is estimated due to lower case reporting during the pandemic. Furthermore, according to the global research nonprofit TB Alliance, about 15% fewer people were being treated for TB in 2020 than in 2019. The diversion of public health resources was one problem, but an even bigger problem was the long periods of lockdowns and various other pandemic restrictions. Many TB victims seeking diagnosis or treatment were simply unable to access services. And even more alarming, it is believed that a substantial number of people who were already being treated for TB at the onset of the COVID-19 pandemic had their treatments interrupted. That is a serious problem because untreated or only partially treated TB can lead to the spread of a drug-resistant form of the infection. Over the last 5 years, the number of people developing drug-resistant TB in the Philippines each year has ranged from 27,000 to 30,000, of which only 1/4 have received treatment. There are medicines available that can work against the drug-resistant TB, though not always, but they are significantly more expensive and difficult to obtain than the usual course of medication used. With the COVID-19 pandemic waning, the government needs to shift its focus back to TB, as well as other persistent public health problems that have been largely overlooked for the past 2 years. The upcoming change in administration offers a good opportunity for a fresh start, using what has been learned from the fight against COVID-19 to improve tracing and treatment of TB cases. On the part of the public, the awareness of the dangers of infectious disease gained from our COVID-19 experience may also help to fight TB. Concepts such as promptly reporting illnesses, taking heed of ventilation, social distancing, and using face masks were novel before the pandemic but have since become habits for most people, and ones we should all keep. They are easy ways to help prevent the spread of TB, as well as other mandates such as colds and flu. And that's the editorial for Wednesday, March 30, 2022. For more news and information, get a copy of the Manila Times on print, subscribe to its digital edition, or log on to www.manilatimes.net. Follow us on Twitter, Facebook, or Instagram, and listen to The Voice of the Times.